right. Which of the following is most likely diagnosis? 4-month-old girls brought to the pediatrician for a well visit. On physical examination, pediatrician finds ambiguous genitalia, including a phallic structure and a single perennial opening. Infant's karyotype is 46XX. Imaging studies reveals both presence of ovarian and testicular tissue. Okay. Ambiguous genitalia. 46XX. It's not Klinefelter's. We talked about that the other day. It's not Turner's. We talked about that the other day. My first thought with ambiguous genitalia was like CAH, which is on here, but I don't know if in CAH you have both sets of tissue there. That doesn't make too much sense to me. Androgen insensitivity makes more sense to me. What is an ovotesticular disorder of sex development? I don't know if I know what that is. CH, they're also not giving like a blood pressure. It doesn't, like, usually I think of like, do they have hypertension or not? That's like a key differentiator.
Okay. What does your gut say? What do you want to go with?
It's either this disorder of sex development, but I don't know what that is, or the AIS.
Okay. So you got to be doing 50-50.
AIS, there's something. AIS, I don't know if they have both tissue either.
Okay.
But I feel like I keep getting confused on like AIS versus 5-alpha reductase deficiency, stuff like that. I would choose, I think, AIS, but I'm not, because I also like the karyotype for AIS. Yeah, I think so, but I'm not super confident.
Okay. It's actually D here. So let's talk
Okay.
about this.
Okay.
Okay. So remember, AIS, is it going to be XY or XX?
Isn't AIS XX?
No. AIS, androgen insensitivity, is XY.
What am I thinking of then?
Yeah. It's male, right? It's genotypically male, but they look phenotypically female. They're going to have,
Oh,
and the
okay.
way they test AIS is not in this scenario. They usually test AIS when
Adolescents, right?
yep,
Usually?
adolescents are older. Okay.
Okay.
And the way, maybe it's not politically correct, but the way that I think of it, okay, is that, a stereotypical, female that you think of that is a model is kind
Yep.
of what AIS is. I'm not sure if
Is
I
that
went
the
over.
Jamie Lee Curtis one where they always say, "Oh, Jamie Lee Curtis," even though
I don't
my
know.
endocrinologist was like, "There's no way." I remember because it was in class. It was so funny, and she's like, it was during endocrine. She's like, "There's no way." They've always said like, "This is the Jamie Lee Curtis thing."
Oh, I have no idea. I don't know. I don't know. I'm bad with pop culture and whatnot, but I do have to
She's
say,
an older, yeah. They used to say it all the time, and I'm like, I don't know, but
gotcha.
because they're
But
like Tom Cruise with Kleinfelter for some reason, and they're always like, "Oh, this one for." Not that these are true. It just helps. It just helps for
sure,
studying. I'm not
sure,
saying these are true
for,
things.
for sure, for sure.
Okay,
Yeah,
but the
just
model thing makes sense. It's like this super feminine looking woman, but it's 46XY. She would be
yes,
46XY.
yes.
Okay.
So the
Okay.
way I explain it, right, on a genetic standpoint of why that happens is, their androgen receptors, aka the ones that sense testosterone, do not work, right? And so,
Okay.
what ends up happening is testosterone allows, those receptors allow, if you think about it, hair growth, things like that, and kind of
Yep.
your, when you hit puberty in locations, right? Like your armpits, right, your pubic hair, etc.,
Yep.
right? And so if those don't work, then you have somebody that is hairless, but they'll still grow taller, and so they're taller and they're skinnier, right? And
Hmm.
then also the testosterone, there's so much of it that it converts to estrogen, which will then grow the breast tissue. And so you have a very tall, skinny woman that is curvy. right? Phenotypically, but then when you genetically test them, they're 46XY. That's how I remember AIS.
And they have also is this the one where they mentioned blind pouch vagina or
Yes, they have a
no?
yes, they have a blind pouch vagina, and sometimes they'll have like testes that are stuck inside because they're
Where
genetically.
where the ovaries would be, right? Like it's that.
Yes. So a lot
Oh,
of the
okay.
times you have to remove those because they have an increased risk of cancer.
Okay.
But yeah, but there are not many things. This is called, like, for instance, this infant here is like true hermaphrodism, right? Truly,
Mm-hmm.
because they have
Mm-hmm.
both ovarian and testicular tissue,
Tissue.
and that in
Okay.
itself will be separated. It's called ovotesticular disorder, which to
Okay.
me I always remember because it's the only one that will have both male and female reproductive parts, right?
Gotcha.
Every other thing will either have insides male or insides female, right?
Okay.
Externally, it can be ambiguous because of the hormones, but internally, it's usually one or the other.
Okay.
Okay.
Okay. So that's just an order. Okay, that's what that is. Okay.